I'm going to tell you about complementary alternative medicine, which I shorten as CAM. Usually I talk about evidence, but today I'm very pleased to see that somebody very clever gave me a slightly different title. It's the evidence debate, the debate about evidence. So I'm going to talk about slightly different things, much more interesting than just the evidence, I think. As an introduction, 4 crucial facts that you ought to know about complementary alternative medicine. It's popular in Britain. According to our own survey recently published, it's about 20% of the population that uses some form of complementary medicine within the year. That doesn't sound a lot, but if you look at patient populations, it's much, much more. This is just the general population, so it's popular. It's not complementary in the sense it's not free. According to one estimate, we spend 1.6 billion annually in the UK on complementary medicine. Most of it we pay out of our own pockets. It's mostly practiced by non-doctors, and therapeutic decisions are taken by consumers mostly, very often, on their own, without any input from healthcare professionals. I think that is very important, that last point, and I will allude to it in my talk. The talk itself, I'm going to ask, why is there debate in the first place? Then briefly, what does the evidence show? That this is my normal, rather boring subject. And then I'm going to speak about limitations of the evidence in complementary medicine and some obstacles. So, why is there a debate in the first place? Because we have some refreshing views on alternative medicine. I've just said to a friend, I sometimes feel like the trainer of the national football team, where everybody in the entire nation thinks he or she knows better. Some of the arguments why there should be a debate is complementary alternative medicine cannot be adequately investigated with the tools of science. That indeed is a refreshing view, but it's wrong. What is evidence anyway? And why should we have evidence if most of conventional medicine is not based on evidence either? So what is evidence anyway? This is what I found in Google News just in the last 2 weeks. Treatments for which homeopathy is promoted as being effective. Some people think that is evidence. Some people who suffer from these diseases may go on the internet and find that encephalitis is treatable with homeopathy. That is a quick way of making suicide, I would guess. And why should we support our treatments with good evidence if most of conventional medicine is not supported by evidence? This is something that many of you will know, which indicates it's the BMJ, I'm afraid. And it seems to indicate that only 11% of all treatments that we have in medicine are actually demonstrably beneficial. In my field, this pie chart is hugely detrimental. And lots of people have tried to find out what the basis of this pie chart is, and we can't. It is totally intransparent. We don't know what it's based on, and I would like to hear somebody explain that to me. It's detrimental because this is just one example of hundreds. Proponents of alternative medicine have this argument: we don't need evidence because you also don't have evidence. And this is just from the current rapid responses from the BMJ, and just one example where this line of argument is being used. So what's the solution? I think pseudoscientists should stop misinterpreting data. That's easier said than done. But also I think the BMJ should make the pie chart transparent. And only then can we answer the question, why should we have evidence if you don't have evidence either? So what does the evidence show? That too is a matter of interpretation, whether you're an optimist, a pessimist, or a legal person. The short answers are CAM is very popular. I've shown you that already. Some forms of complementary alternative medicine work, some don't. And some forms of CAM are safe and some are not. As I said, that's a very short answer of a very complex issue. Being critical has earned me this. Most people are proud to be depicted in the Times in that way. I was very proud, I must say, but I wasn't proud about this. I'm definitely not a quackbuster, and I'll show you why. I got so annoyed at being called a quackbuster that in one publication I selected the treatments and indications for which we have demonstrated by the means of good science and evidence-based medicine that these forms of CAM do have effectiveness. That was about 5 years ago, and now we have to cross out this in the view of newer data. But it's still quite a list, and it's not the end of the list. Here's the second slide. And again, we have to cross out one for which soil palmetto, there were recently 2 publications which cast doubt on its efficacy for BPH. So I doubt that many researchers in this field have shown so many treatments to actually be effective. So I'm not a quackbuster, but I'm critical, and I have to stress that an uncritical scientist is a contradiction in terms. So some alternative treatments work, but far too many are promoted. For instance, far too many which are not effective are promoted. For instance, on 50 million websites. Would you believe it? It's 50 million if you Google alternative medicine. And 99.999% of these websites are utter rubbish. And one who's promoting a lot in this field is Prince Charles. He would like us and the NHS to be force-fed with alternative medicine if he had his way. This is from a little exercise we did about 5 years ago. We bought, at great expense, the 7 books, I think it was, which were bestsellers in the field of alternative medicine, and we extracted from these 7 books the indications for which there were more than 50 different CAM treatments recommended in these books. And just to pick out one, asthma. For asthma, 119 different treatments were being recommended by just 7 authors. Can you imagine that? I can tell you, after reviewing the field, that no alternative treatment is an effective treatment for asthma. Yet this level of misinformation exists, and we have to deal with it when seeing our patients, because patients will know about some of this. Another important bit of misinformation is that because it's natural, it is safe. Very early on in my work in Exeter, I declared that for me, the safety issues related to alternative medicine are a priority. And here's roughly what we found out in 2 decades of research. There are many issues related to the safety of various treatments. For instance, the toxicity of herbal medicines. Here are rough estimations of documented deaths caused by that. herb-drug interactions, we know far too little at present about it. We were only beginning to understand this area. Acupuncture needles going into organs where they shouldn't belong, most frequently in the lungs, about 100 deaths reported. And I think the most worrying bit is this one, spinal manipulation. 50%, every second patient going to a chiropractor will experience mild to moderate adverse effect. But in addition to that, we have about 700 documented cases of severe complications. What happens is that the vertebral artery dissects, and we then are confronted with a stroke, and about 100 deaths have been documented. And this is almost certainly just the tip of a much, much bigger iceberg, because we have documented that these cases usually do not get reported at all. The important thing also is that if a medical intervention is not effective, it's also not safe, particularly if we use it to treat life-threatening conditions. It cannot possibly be safe in such circumstances. With homeopathy, we have at least a little bit of systematic research to show you that. This is a very modest little survey that we've done a while ago. We got the email addresses of all homeopaths that we could, 104 homeopaths, and we pretended to be a mother asking advice about MMR vaccination. That was at the height of the MMR scare in Britain. The protocol was such that we had to give these respondents the occasion to withdraw after telling them that they were actually research objects, and some of them withdrew. So we only had 77 respondents left. Of these, only 3% advised to immunize the child, and 40% advised not to immunize the child. The rest was somewhere in between those two extremes. So the homeopathic remedy might be free of adverse effects. The homeopath certainly isn't. I'm now coming to the what I call the limitations of evidence in complementary medicine, and by this I mean foremost the lack of plausibility of these treatments. In evidence-based medicine, we do not actually ever focus on the plausibility of a treatment. Biological plausibility is almost not important. We just want to know whether a treatment works and not how it works. And that may be the strength of evidence-based medicine, but in CAM, it is also its weakness. Again, homeopathy is a very good example for that. It's based on the like cures like principle and on what I call less is more principle. Homeopaths dilute their remedies until there's no single molecule present any longer in the actual remedy. And both of these principles fly in the face of science, and therefore the biological principle of homeopathy is zero. Another limitation is the misinformation, which I strongly emphasize several times in my talk today. This is directly from the present website of the Society of Homeopaths. That is the organization for non-doctor homeopaths. And this is a quote: "There is sufficient research to support the use of homeopathic treatment for the following medical conditions." And you see a list of conditions, and your patients will see this list of conditions, and they will say, oh, well, if it's on the website of the Society of Homeopaths, that must be true. It isn't. I was particularly struck by this one, post-operative ileus, because as the evidence on the website, they use my publication for that. And it's the publication of this meta-analysis, which we published a long time ago. It's a meta-analysis of homeopathic remedies for ileus. You can see that apart from one study, they're all positive, and the overall result is also positive. But what you don't see on the graph is that this is the only study of scientific rigor, and also the largest study, and therefore this study is what we should focus on. Our conclusions, therefore, say that the majority of the clinical trials are positive, and the overall result is positive, but there's several caveats preclude a definitive judgment. Yet, I find this claim that homeopathy is a cure for postoperative ileus on the website of the largest professional organization of homeopaths in this country. So, misinformation is a very important limitation to the evidence in my field. And I conclude that in CAM, we ignore plausibility at our expense and peril. Lastly, obstacles to evidence, and there are too many to mention, I'm afraid. I'm therefore only going to mention one, and this is also my interactive slide. The tongue-in-cheek question that I want you to vote on is, why is he sporting this hat? You have 5 possibilities, and would you please vote now? I think you have, the majority has correctly identified that he was actually visiting a homeopathic manufacturer, and he had to wear this hat. He was visiting Nelson's, who also produces his detox tincture, which I called dodgy instead of Dutchy originals once. Prince Charles was the patron of the Prince of Wales Foundation for Integrated Health, which had to close about a year ago amidst allegations of money laundering and financial fraud. But only weeks after the closure of this organization, a new organization was created with much the same people. It was meant to be called the College of Integrated Medicine, but integrated was dropped, and it's now called the College of Medicine. In my view, this is a true obstacle for getting to the bottom of reliable evidence in my field, and I'm going to show you why. On the website, we can read that the college are prepared to consider complementary as well as orthodox interventions. Nothing wrong with that, in principle, as long as they are evidence-based. We also see on the website that they have something they call innovation networks, where they show initiatives that they showcase as working well and as potentially informing the NHS about what is good medicine. I've extracted from the 14 innovation networks what they actually mentioned in terms of therapy, and here is what they mention. When you see figures, that means acupuncture was mentioned 14 times by these 12 times by these 14 initiatives, aromatherapy 3 times, etc. You can see that we are dealing with all sorts of alternative medicines, complementary medicines, and we don't see any orthodox medicine at all. So I suspect that this is yet another initiative to smuggle unproven or disproven treatments into the NHS and routine healthcare. And finally, simple transparency and honesty would help, wouldn't it? If we want to get rid of obstacles of evidence. And I'm going to show you just one example. This is also from the BMJ. The current rapid responses has an interesting discussion on homeopathy, and I'm a little bit involved in that. And it shows one response stating that the evidence for homeopathy is very strong, and some references for that, which we in due course have taken apart and shown that these references are less than reliable. And this is signed by everybody who has a name in homeopathy. An impressive list of people, which lends a lot of support to the claim that homeopathy has been shown to be effective. But I'm not going to stress the long list of names, but this one: competing interests, none. If the great and the good of homeopathy have no competing interest in homeopathy, I eat my hat. And therefore, I would like to rest my case. There should not be a debate about the evidence in complementary medicine. There is no debate about the evidence in gynecology, neurology, internal medicine, or rheumatology. Why should there be one in complementary alternative medicine? I've shown you that not all the evidence in my field is negative, and I was instrumental in pointing that out and producing some of the positive evidence. And lastly, and importantly, I want to stress that true progress in complementary medicine will be made not by those many enthusiasts who introduce double standards, but by those applying rigorous science. Thank you.
Thank you very much, Edzard. It's a very insightful presentation, and thank you for shining some light on what seem to be some quite dubious practices, practices that I wasn't actually aware of before. I just wanted to speak very briefly to your question around clinical evidence and the editor-in-chief of clinical evidence, and just offer some explanation around the pie chart that we produce. It's essentially a pie chart of the interventions that we've looked at within our publication. So by no means is it actually intended to be an audit of clinical practice. We often get inquiries from people, particularly because of this controversy around complementary therapy, and people, are looking at these kinds of sources of information to see if this is going to shine any light on that discussion. But actually, it's purely a representation, a pie chart of the interventions that we've chosen to look at based on 100 or so common conditions in primary care. So that's not necessarily reflective of what's going on in the wider world, and it's not an audit of real-life clinical practice. It's not saying that X% of interventions in medicine are effective or ineffective. It's a proportion of the interventions that we've looked at in our particular data set. So that was just by way of clarification. I was also interested in your slide, which described the number of side effects that were attributable to different homeopathic treatments. And I was wondering, sort of in the spirit of evidence-based medicine, if you could give us some idea of the absolute risks, because I looked at the number of people who might, for instance, have a side effect or suffer an adverse event from a complementary therapy, and you reported those as numbers of cases in absolute terms. But actually, I was wondering, as a proportion of the number of people, for instance, who undergo chiropractic treatment, what sort of proportions might we be thinking about? Thank you.
Thank you very much for this clarification of the pie chart. I'm not sure that I fully understand it, but I would urge you to point out what you have pointed out to us on the website, because it really is irritating to hear the argument over and over and over again. And we have written articles, we have refuted the arguments of the other side so many times, and I think you ought to make it transparent what the pie chart is based upon. To answer your question about absolute and relative risk, I would love to be in a position to answer it, yet I can't. The crucial point, and I should have mentioned that in my talk, while we have mechanisms of post-marketing surveillance, etc., to identify problems in conventional medicine, we have no such thing in alternative medicine. Quite on the contrary, we have shown fairly conclusively with one particular survey of British neurologists a few years ago, where we asked them, have you seen any complications after spinal manipulation in the last 12 months? And about 40 such serious complications emerged from this, which is not a lot, but the important bit was that underreporting in this instance was precisely 100%, by which I'm trying to say that none of these 40-odd complications had been anywhere reported at all. So if you have no reporting system of adverse effects, you cannot calculate reliably, you cannot even begin or dream of calculating reliably either absolute or relative risks. So I think that is why I have tried to stress that this area of research, the safety issues of complementary alternative medicine, is probably the most important issue of all that are researchable in this area. Quite simply, safety is far too important to leave it to opinion. We need data.
We've got a question here at the back and one here at the back there.
Hi, Peter Bragg from Australia. One of the challenges we have in Australia is that CAMS practitioners don't have the same registration requirements as they do as other health professionals. I just wonder, in the UK, what are the regulations that govern practice of CAMS professionals, and what do you think the role of regulatory and other mechanisms is?
A huge issue, thank you, and a good question. We have chiropractors and osteopaths in this country regulated by statute, very similar to doctors and other regulated healthcare professions, which, by the way, didn't stop them claiming lots of nonsense. And when Simon Singh exposed that as the nonsense that it was, instead of saying, okay, we'll get our act together, they sued him. So that regulation isn't a complete safeguard against nonsense. There's regulation in the pipeline for other complementary healthcare professionals, and I believe that acupuncturists and herbalists will shortly be regulated by statute as well. Homeopaths, not in the foreseeable future. All of us could be homeopaths tomorrow if we can spell the word correctly and nail a sign at our door.
I like the categorizing treatments between those that are based on evidence, those not based on evidence, and those that are unsure. I'm not sure what adding the label CAM adds to anything, and I'm wondering if this, what I consider to be a false dichotomy, has clouded your comparison between CAM and conventional therapy. I mean, you complain about the pie chart, but you've got 1,000 papers, 40 books. Why didn't you do the research to figure out what the evidence base for conventional medicine is? MMR, you asked homeopaths. Why didn't you also ask a sample of conventional practitioners? Expense, 1.6 billion on CAM. Why didn't you put beside that how much they spend on conventional therapy? Side effects, same thing. You looked at Google News to find ridiculous claims of CAM. Why not search Google News for ridiculous claims about conventional therapy? Misinformation. What about off-label uses for drugs that have been approved? So I don't think that your comparison was fair. Your conclusions might be all true, but I think you need to make a fair comparison.
I didn't make comparisons at all. I gave a lecture on complementary alternative medicine. My subject was not to
the main point of the lecture was that you wanted to answer one of the objections that...
Let the chair, let him finish.
I didn't make a comparison, and I couldn't possibly make a comparison because it would be a huge task. We have defined or tried best to define which treatments work, which are safe, and which don't work, and which are not safe. To make comparisons to mainstream medicine would be an entirely different subject and way beyond my competence. And I don't know a chap in this world or woman that could do it competently.
Hi there, I'm an orthopaedic registrar from Harlow. I just wanted to bring up something that I think you alluded to, and that's that not only do complementary medicines have side effects and poor effects themselves, but they also delay the first presentation of people to their primary physicians or to the appropriate healthcare worker. I myself had a case a couple of years ago of a young lady who suffered a cauda equina, lost the use of both of her legs, bladder and bowel. She'd been seeing an acupuncturist and a chiropractor for a couple of weeks previous to that. I wonder, since we as healthcare professionals actively discourage things like smoking, obesity, junk food eating, should we be actively and publicly discouraging the use of these complementary medicines that have no evidence base?
Thank you for making the point. It's a very good point. The delay of treatment is a very good point, and I tried a little bit to allude to it by saying the therapy might be safe, but the therapist isn't, and I entirely agree with you. The problem is that there's no systematic research into this particular issue. Anecdotally, we know that this happens, and it's very regrettable when it's happened, but it would be difficult, if not impossible, to research systematically. Your question was, should we actively discourage people from smoking and alternative medicine? I wouldn't go that far. We all live luckily in free countries, and everybody can do what he or she wants. But what we can do and should do is provide reliable, honest, unbiased information based on good evidence. And that is difficult enough. And some patients might not want to hear it. I'm afraid if you discourage them outright, and if you really show a negative attitude to it, you lose them. There are some very strong believers, almost religious believers into certain forms of alternative medicine, and they won't trust you anymore, and you don't want to lose the trust of people, but you can gain trust by offering them honest and reliable information.
Let's take one question down here.
Yeah, I just wanted to ask you, what website would you recommend as the best evidence-based complementary medicine reference point for a practicing physician, seeing that so many of our patients come in who are taking alternative medicines and complementary medicines?
It's very tempting to promote my own book. It's several actually. One is called the Oxford Handbook of Complementary Alternative Medicine. Is one of those small, tiny books that fits into your pocket, and it's evidence-based, very, very simple for the busy clinician. If you want more detailed information, we have another book that is fully referenced. It's called The Desktop Guide for Complementary Alternative Medicine. But your question was related to websites. There's one there. I get much more hesitant there. There's one which is so-and-so, almost decent, and that is by the NIH in America. They have an office for complementary alternative medicine, and it is I would call it slightly uncritical, but at least it doesn't tell you outright lies.
Hello, I'm Aniket Tiwari. I'm a clinical fellow at the BMJ. I agree with much of what you say. The thing is, patients seem to like these alternative therapies. And I've come across many GPs and things who dabble in homeopathy or acupuncture because it's what patients want. My question is, with the NHS reforms, as GPs get much more power to commission services they want to, and indeed an increasing commercial focus is an inevitable consequence, do you think there'll be an increase in CAM? And is there anything we can do to stem this tide, because it goes against evidence principles?
Honestly, I haven't got a clue. what the future holds, whether there will be an increase with the new systems being introduced or decrease. Financially hard times tend to decrease alternative medicine usage, and the usage of homeopathy has dramatically in the last years decreased in the UK. But I try to be a good scientist, but I'm very bad at reading tea leaves.
The last revision of the Cochrane review about acupuncture in headache demonstrated the efficacy of sham acupuncture, and the same efficacy of sham acupuncture as true acupuncture and drugs. How should we consider sham acupuncture, a sort of very complementary medicine? What do you think about it?
This is a very good question and a difficult one to answer. Just to explain to the audience, some trials, big mega trials almost, have used various forms of sham acupuncture, sticking the needle in the wrong point or just needling superficially, or indeed having needles that do not even penetrate the skin. We developed such a needle, for instance. And the results of some of these trials seems to be that sham acupuncture is as good as real acupuncture, and both are better than doing nothing, or both are better than standard care even. And this is a conundrum to interpret. It really depends whether you're an optimist or pessimist. The world of acupuncture says, fine, acupuncture is a complex intervention. We can't just judge the needling, it's the interaction and so forth, and of course it's good. To me, if you're halfway critical as a scientist, it shows that acupuncture is a placebo. And is placebo usage ethical in clinical practice? No, it isn't.